Aortic stenosis, left atrium, left ventricle, aorta. Between left ventricle and aorta lies your aortic valve. This is a tricuspid valve. So here the orifice, in spite of being like this, gets narrowed. As a result, the left ventricle has to generate excess pressure to push the blood forwards into the aorta. This is aortic stenosis. Coming to the etiology. As with any other valvular heart disease of the left side, rheumatic heart disease. Next is due to atherosclerotic, that is calcific aortic stenosis. Other causes are congenital bicuspid aortic valve. These are the common causes for aortic stenosis. Next, coming to the presentation, clinical features. The patient presents to us with symptoms of, remember it as SAD, that is syncope, angina and dyspnea. Because of the decreased cardiac output, patient will have cerebral hypoperfusion leading on to syncope. Since the perfusion also affects the ventricular myocardium, patient can develop chest pain on exertion, that is angina and dyspnea. So this is the classical 3 symptoms of aortic stenosis: syncope, angina, dyspnea. Coming to the clinical findings, the patient will be having a low volume or small volume pulse. Next, the patient will be having a heaving apical impulse. As you know, this is a pressure overload condition, so the apical impulse will be heaving, that is, it will be localized to one intercostal space and it will lift your finger. This is heaving. Next, the patient will be having an ESM, that is ejection systolic murmur. This is your S1, S2 and S1 again. So more or less resembles like a diamond shaped murmur, ejection systolic murmur. Next, coming to the diagnosis, it is diagnosed by echocardiography, and ECG can show left ventricular hypertrophy. Then how to assess the severity in AS? Severity. 1. It is upon the pressure gradient across the aortic valve. Mild, moderate and severe. It will be less than 25, 25 to 40 and more than 40. This is one criteria. Next one is presence of S3. Third criteria is presence of S4. Next one is based upon the valve orifice, that is aortic valve orifice. It is normally 3 to 4 centimeter. Less than 0.75, less than 1 indicates severe AS. This murmur that which is heard in the aortic area can radiate to your mitral area also. We know this murmur can radiate to carotid, and the murmur can be escalated in the carotid also, and this murmur can be felt, that is a thrill can be felt in the carotid, which is called as carotid thrill. The same murmur here can be heard in the mitral area also. This is called as Gallawardin phenomenon. G-A-L-L-E-A, Gallawardin, V-A-R-D-I-N, Gallawardin phenomenon. And one more criteria to assess the severity is the duration of murmur. We know that the murmur will be a diamond shaped murmur, that is the peaking will be at the middle. Suppose if the peak occurs in the later part, it indicates severe AS. So how to treat? As with any other rheumatic heart disease, you have to give penicillin prophylaxis. and use diuretics and vasodilators with caution because the patient are already having low volume pulse, low cardiac output. So diuretics and vasodilators has to be used with caution. That too when the patient has moderate to severe AS. And the complications are patient will go in for heart failure, patient can develop infective endocarditis, and patient can develop arrhythmia. So it's a small outline on aortic stenosis. Aortic stenosis, in a nutshell, the etiologies are rheumatic heart disease and calcific aortic stenosis apart from congenital bicuspid aortic valve. The patient will be having syncope, angina and dyspnea. The patient will have a heaving apical impulse and ejecting systolic murmur which conducts to the carotid as well as mitral, and this phenomenon of where the murmur conducts to the mitral area is called as Gallaudet phenomenon, and this murmur is typically a diamond shaped murmur, and the severity is assessed by the presence of S3, S4 and late peaking of the murmur and valve gradient across the aortic valve. One more thing I forgot to tell you, this aortic stenosis is classified into 3 types according to the point of narrowing. It could be either valvular or subvalvular or supravalvular. Aortic stenosis can be at the level of valvular, which is our typical case as with rheumatic heart disease, and subaortic as with HOCM, and supravalvular as in Williams syndrome. Thank you.